Welcome to the deep dive. We're going to take your sources and turn them into pure knowledge gold. Today we're going full on nursing, focusing on the core of it all, knowledge itself.
That's right.
And this one is for all you future nurses out there, figuring out this exciting but sometimes pretty tricky world of nursing school.
Exactly. We're going to be exploring those foundations of nursing knowledge, what it is, where it comes from, and how it really shapes the care you provide.
Okay, so let's just jump right into it. When we say, nursing knowledge, what are we even talking about? I mean, is it just like memorizing textbooks?
It's so much more than that. Think of it this way. Nursing knowledge is really your understanding of the world, built through learning and exploring. But here's the thing. It's not just about one subject,
Yeah.
It's like weaving a tapestry, pulling threads from all sorts of fields like science, philosophy, ethics, and even sociology. All of these really help a nurse to truly understand a patient's needs.
That makes a lot of sense because you can't just focus on a patient's physical health, right? Their environment, their emotions, their cultural background all play a role.
That's right. And that's where those different sources of nursing knowledge come in. Let's start with traditional knowledge. Those practices that have been passed down from generation to generation of nurses.
Okay, yeah, like changing bed linens every day. I remember learning about that in class, but also hearing that it's not always necessary.
That's a great example of how nursing knowledge is always evolving. Changing linens daily, something nurses have done forever, but recent evidence is challenging that practice. It may not actually be needed in all cases and could even have downsides we didn't even realize before.
So what we've always done isn't always what we should be doing.
Right.
That's where questioning things and looking at the evidence comes in.
You got it.
Yeah.
Traditional knowledge is important, but we can't just blindly follow it. We need to test those practices against scientific findings. And that's where evidence-based practice becomes so important.
So if tradition isn't the only source of knowledge, what else is there?
Well, there's also what's called authoritative knowledge. This is what you learn from experts in the field. Think about a senior nurse showing a new grad a more efficient way to start an IV. It's definitely valuable, but it's important to remember that even experts can have limitations based on their own experiences.
Okay, so how do we know which knowledge to rely on then?
That's where scientific knowledge comes in. This is knowledge that comes from research using the scientific method to test ideas and measure results. This helps nurses move beyond just opinions and traditions to provide really effective care based on solid evidence.
Now I'm starting to see why research is such a big deal in nursing. But for those of us who are new to this, can you give me an example of how scientific knowledge actually gets used in everyday nursing?
Absolutely. Imagine a patient recovering from surgery. The nurse uses scientific knowledge about things like anesthesia, pain medication, and how the body heals after surgery to develop a solid post-op care plan.
Okay.
This plan isn't based on guesswork, but on evidence from research about what works best for patients in these situations.
Wow, so it's like using a roadmap to guide your actions and make sure you're giving the best possible care. It sounds like this scientific approach has really shaped how the nursing profession has evolved.
You're exactly right. And speaking of shaping the profession, we can't talk about nursing knowledge without mentioning Florence Nightingale.
Ah, yes. The lady with the lamp, she's an icon in nursing.
And for good reason. She was a pioneer of using data to improve care, even back in the Crimean War.
Wow.
Her meticulous records showed that hygiene and sanitation drastically reduced deaths. It completely changed how we think about patient care.
It's incredible how one person's dedication to observation and data could have such a lasting impact. It really laid the foundation for how we approach nursing today.
It really did. And her work really paved the way for the development of nursing theories, which give us these frameworks for understanding and applying nursing knowledge in practice.
Yeah, theories are important, but I remember finding them a bit intimidating at first.
Sure.
Can you break those down for us?
Of course. Think of a theory as a blueprint that helps explain how things work. It's a set of concepts that describe a pattern in reality. To make it even clearer, imagine building a house. The bricks are like individual concepts, and the blueprint, or conceptual framework, shows you how those bricks all fit together to create that whole structure.
I love that analogy. So how do these blueprints apply to what nurses do?
Nursing theories help us describe, explain, predict, and even control the outcomes of care.
Okay.
They give us a way to understand why we do what we do and how our actions impact patients.
It's like having a mental toolkit for nurses.
Exactly. And it's important to note that nursing theories often draw from other disciplines, too. We see influences from general systems theory, adaptation theory, and developmental theory.
Those sound familiar, but can you give us a quick refresh?
Of course. General systems theory looks at how different parts of a system connect and how a change in one part affects the whole, like how a change in a patient's diet could impact their overall health or even their mental well-being.
That's a great example. It shows how interconnected everything is. What about adaptation theory?
Adaptation theory is all about how individuals adjust to changes in their environment and their health. This is super relevant to nursing since our patients are often dealing with major life changes and health challenges.
Makes me think about how we support patients emotionally as they cope with illness or injury. What about developmental theory?
Developmental theory helps us understand the stages of human growth and development throughout life.
Hmm.
Think about Erik Erikson's stages of psychosocial development. That's a classic example. And most nursing theories, regardless of their specific focus, share 4 common concepts.
This is getting really interesting. What are those 4 concepts?
The most important one is the person or the patient. Everything in nursing comes back to focusing on that patient and their well-being.
That makes perfect sense. What else do these theories consider?
We also look at the environment and how it impacts the patient's health. This could include their physical surroundings, social support systems, cultural influences, even things like their financial situation.
Wow, it really takes a holistic view, considering everything that might affect the patient. What are the last 2 concepts?
The third one is health, where we define what it means to be healthy and what contributes to illness. And lastly, we consider nursing itself. This defines what nurses do and the nature of the care we provide.
It's like we're piecing together a puzzle, understanding the whole person within their unique context, and then figuring out how nursing can best support their health and well-being.
You've got it. And that leads us to the vital role of nursing research. Remember, it's not just about applying existing knowledge, it's also about seeking out new knowledge and constantly improving our understanding of how to provide the best care possible.
So we're not just following orders, we're thinking critically, asking questions, and always looking for ways to do things better. It makes me think of myself as more of a detective than just a nurse.
I like that, and that's exactly what research is all about. Nursing research is a systematic way of using data to describe, explain, or predict things. It's about testing our assumptions, validating what we do, and discovering new and improved ways to care for our patients.
It sounds like a never-ending quest for knowledge.
Yeah.
I'm curious, how has nursing research evolved over the years?
It's come a long way. In the early days, it was mostly focused on, developing nursing practice standards and educational programs. Then, as technology advanced, research started to explore more complex clinical interventions like those used in intensive care.
So research has been driven by the changing needs of healthcare and the desire to keep improving patient outcomes.
Exactly. And a major turning point was the establishment of the National Institute of Nursing Research, or NINR, in 1993. This put nursing research on equal footing with other health research fields, and we saw a huge increase in funding and groundbreaking discoveries.
That's incredible. Sounds like the NINR is still doing important work today.
Absolutely. They're focusing on crucial areas like symptom science, promoting wellness, helping people manage chronic illnesses, and improving end-of-life care.
It's amazing to see how far nursing research has come. But I have to admit, those research articles can be a bit intimidating, especially when you're just starting out.
I understand. They can be filled with jargon and complex information. But here's the key. You don't have to be a research expert to benefit from evidence-based practice. Start by breaking the article down into smaller parts. Focus on the abstract, the introduction, and the discussion sections to get the main idea. Look for those key findings that are relevant to your practice.
That's a great tip. It's like creating a roadmap to understand the article, focusing on the most important points first.
Precisely. And don't be afraid to ask questions. If there are terms or concepts you don't understand, look them up or talk about them with your classmates or instructors.
It's all about being curious and not giving up when things get challenging.
Exactly. The more you practice reading and evaluating research, the more comfortable you'll become. And as you develop your skills, you'll become a more confident and effective nurse, advocating for your patients based on the best available evidence.
That's really encouraging to hear. It sounds like we've covered a lot of ground already, from the different sources of nursing knowledge to the importance of research and evidence-based practice.
And don't forget how those foundational nursing theories act as the building blocks for everything nurses do.
You're right. It's all connected. Before we move on, I wanted to touch on a concept that was briefly mentioned in our source material, Research utilization.
Okay.
What exactly does that mean?
Good question. Research utilization, or RU, is all about bridging the gap between what we learn from research and what we actually do in practice. It's about taking those valuable insights from studies and turning them into actions that improve patient care.
So it's not enough for researchers to just publish their findings. That knowledge needs to reach nurses at the bedside and be put into action.
You've got it. And nurses play a crucial role in making that happen.
Right.
We need to stay up to date on the latest research, figure out what's relevant to our practice, and then find ways to incorporate those findings into our daily care.
But you mentioned earlier that there can be barriers to putting research into practice.
Yeah.
What are some of those challenges?
That's right. Nurses are busy. They may not have enough time to read research. They might need more resources or support to make changes. Or they might face pushback from colleagues who are hesitant to try new things.
So it's not always easy to integrate research into practice. What can we do to make it easier?
That's a great question and something we'll dig into further. Because even though it can be tough, it's crucial. The whole point of nursing research is to make things better for our patients, and that only happens if we actively use the knowledge we gain from those studies.
That's a powerful reminder. It sounds like a call to action for all nurses to be lifelong learners, embrace evidence-based practice, and be champions for using research to improve care.
Exactly. And by doing those things, we can help shape the future of nursing, ensuring that our practice is always grounded in the best available evidence.
I love that idea that we have the power to shape the future of nursing. This has been so insightful already. What are some of the key ways that research actually gets put into practice at the bedside?
That's where evidence-based practice, or EBP, comes in. It's not just a trendy term. It's a fundamental shift in how we approach nursing care. EBP is all about using the best available evidence to make decisions that lead to better outcomes for our patients.
So instead of just doing things the way they've always been done, we're constantly learning and evolving our practice based on new research.
Exactly. EBP doesn't just rely on research studies, though. It also considers clinical guidelines, expert opinions, and even patient preferences and values.
So it's about finding that perfect balance between scientific evidence, what we know from experience, and what matters most to our patients.
That's a great way to put it. And there's a specific process nurses use to implement EBP. It all starts with asking a clinical question.
So basically identifying a problem or something we need more information about to guide our care.
Right. And to make sure our question is clear and focused, we use a specific format called PEC.
PCT. Now that sounds familiar. Can you remind us what that stands for?
Of course. PISOT stands for Patient, Intervention, Comparison, Outcome, and Time. So you might ask something like, in patients with type 2 diabetes, P, does regular exercise, compared to no exercise, C, improve blood sugar control, O, over a period of 3 months, T?
I can see how that helps to narrow down the research and make it more targeted. What happens after you have your PISOT question?
Then it's time to dive into the research. You'd search reliable databases for studies and articles that address your specific question.
And this is where those research skills we talked about earlier come in handy. Right? Knowing how to find reliable information and how to evaluate the quality of the evidence.
Absolutely. It's important to remember that not all research is created equal. You need to look at things like the study design, the number of people involved, and any potential biases to decide if the evidence is trustworthy and relevant to your patients.
It's like being a detective, carefully looking at the clues to decide if the evidence is strong enough to base your practice on.
Exactly. Once you've gathered and evaluated the evidence, you need to combine it with your own clinical experience and the individual needs and preferences of your patient.
So EBP isn't about blindly following research findings. It's about using your judgment and considering the whole person, not just the data.
You got it. EBP isn't a one-size-fits-all approach. It's about making informed decisions for each unique patient. And after you've implemented a change based on the evidence, it's important to evaluate the outcomes and see if it's actually making a difference.
That's the whole point, right? We want to see if those EBP changes are leading to better care and better results for our patients.
Exactly. And if something isn't working as well as we expected, we go back, adjust our approach, and keep working towards improvement.
It's a dynamic process, always evolving and adapting to new knowledge.
Precisely. And that brings us to another important concept in nursing: quality improvement, or QI.
Okay, I've heard that term a lot, but how is QI different from EBP?
That's a great question. While EBP focuses on using research to make decisions about individual patients, QI takes a broader view. It looks at systems and processes to improve overall healthcare quality and safety for everyone.
So it's less about specific interventions and more about making sure that the whole system is running smoothly and safely.
Exactly. QI involves things like identifying areas where care could be safer or more efficient, making changes based on data, and then tracking those changes to see if they're having the desired effect.
So QI is more of a team effort with everyone working together to improve healthcare.
Precisely. Nurses are key members of QI teams, using their experience on the front lines and their critical thinking skills to identify problems, come up with solutions, and evaluate how well those solutions are working.
It seems like EBP and QI both play a crucial role in advancing the nursing profession and making sure we're providing the best possible care.
Absolutely. There are two sides of the same coin working together to make sure that nursing care is compassionate, evidence-based, and constantly improving.
Speaking of improvement, can you tell us a little more about how QI actually works in practice?
That's where QI models like PDSA come in.
PDSA, that rings a bell. It's like a cycle of planning, doing, studying, and acting right.
You got it. PDSA stands for Plan, Do, Study, Act. It's a structured approach to testing out changes, in a real-world setting.
Right.
You start by planning a change, then you try it out on a small scale, study the results, and then decide whether to implement it more broadly or adjust your plan based on what you've learned.
So it's a continuous feedback loop where you're always tweaking and improving based on real data. It's cool to see how EBP and QI work together to bring about real change in nursing.
They really do, and they both rely on a questioning attitude, a commitment to using data, and a willingness to challenge the status quo to improve patient outcomes.
So as nursing students, we should be developing this mindset right from the start.
Absolutely. Every time you ask why and look for evidence to support your actions, you're contributing to the advancement of nursing. And you're not alone in this journey. There are tons of resources available to help you navigate the world of nursing research and EBP.
Like those online databases you mentioned earlier, SynHL and Medline.
Yeah.
I've definitely spent some time exploring those.
Those are great places to start. And don't forget about professional organizations like the American Nurses Association. They provide evidence-based guidelines and position statements that can be super helpful in guiding your practice.
It's good to know there's support out there.
Yep.
But I have to admit, sometimes those research articles can feel overwhelming, especially when you're just starting out. Any tips for tackling it?
I completely understand. They can be dense and full of jargon. But remember, you don't need to be a research whiz to understand and apply EBP. Try breaking down the article into smaller sections. Start with the abstract, the introduction, and the discussion to get the gist of the study. Look for the key findings that you can actually use in your practice.
That makes it seem a lot less daunting. It's like creating a roadmap for navigating the article, focusing on the most important landmarks first.
Exactly. And never be afraid to ask questions. If there are terms or concepts you don't get, look them up or discuss them with your classmates or instructors.
It's all about being curious and persistent,
Mm-hmm.
right? Not giving up when things get tough.
Absolutely. The more you practice reading and evaluating research, the more comfortable you'll become. It's like anything else. The more you do it, the easier it gets.
And the more confident we'll feel using research to provide the best care for our patients.
Exactly. And that's really what it's all about. EBP empowers you to be a more effective nurse, advocating for your patients based on the best available evidence.
It makes me feel like we have real power to make a difference in people's lives. We've covered so much in this deep dive already, from the foundations of nursing knowledge to the importance of research and evidence-based practice. But before we wrap up, I'd love to circle back to a specific example you gave earlier. You talked about how scientific knowledge can be used to create a care plan for a patient recovering from surgery. Can you walk us through what that might look like in more detail?
Of course. Let's say we have a patient who just had knee replacement surgery. Using scientific knowledge, the nurse knows that this patient is at risk for several things, like pain, blood clots, and difficulty moving around.
Okay.
So the care plan would include things like,
Okay, so this is where those nursing interventions come in, right?
yes,
Specific actions the nurse takes to address the patient's needs.
exactly. To address pain, the nurse might administer pain medication as ordered by the doctor and teach the patient non-pharmaceutical pain management techniques like relaxation or distraction.
I've heard that managing pain effectively is really important after surgery, not just for comfort, but for healing as well.
That's right. And for preventing blood clots, the nurse might apply compression stockings to the patient's legs or encourage ankle pumps and other leg exercises. They might also administer blood thinners as prescribed.
It seems like a lot of this is about getting the patient moving as soon as possible, even if it's just small movements at first.
You're exactly right. Early mobilization is crucial after surgery. It helps to prevent complications like pneumonia, blood clots, and muscle weakness. So the care plan might include helping the patient get out of bed and walk short distances several times a day, gradually increasing the distance and difficulty.
That makes a lot of sense. And it shows how all those different pieces of knowledge from anatomy and physiology to pharmacology all come together to create a plan that addresses the whole patient.
You've got it. And the beauty of EBP is that we're always refining these care plans based on the latest research. For example, we might learn that a certain type of pain medication is more effective or has fewer side effects, or that a specific type of exercise is particularly helpful for preventing blood clots after knee surgery.
So we're constantly learning and improving. That's really inspiring. I'm curious, are there any real-life examples of how EBP has led to changes in nursing practice?
Oh, absolutely. There are countless examples. One that comes to mind is the practice of using chlorhexidine wipes for bathing patients in the ICU to prevent infections.
I've seen those wipes used on the floors.
Yeah, they're pretty common now, but it wasn't always that way. Research showed that using chlorhexidine significantly reduced the rates of central line-associated bloodstream infections, which can be very serious and even life-threatening.
So that's a case where research findings directly led to a change in practice that's now saving lives. It's amazing to think about the impact nurses can have on healthcare.
It really is, and this is just one example. EBP is constantly leading to improvements in areas like wound care, pain management, fall prevention, and countless others.
This has been such an eye-opening deep dive. I'm feeling really inspired to keep learning and growing as a nurse.
That's fantastic to hear. Remember, you're embarking on an incredible journey, and nursing knowledge is your most valuable tool. Keep asking questions, stay curious, and never stop exploring.
That's great advice. So for all of our listeners out there who are just beginning their nursing journeys, what's one key takeaway they should keep in mind?
I would say, always be open to learning and growing. Nursing is a constantly evolving field, and the best nurses are the ones who embrace that change. Read research articles, attend conferences, ask your instructors and mentors lots of questions.
It sounds like curiosity is really a superpower for nurses.
It really is. And don't forget that you're part of a community of learners. Lean on your classmates, your instructors, and other nurses for support and guidance.
That sense of community is so important, especially when you're first starting out. It's like we're all in this together, constantly learning and growing as a profession.
Exactly. And by working together and embracing EBP, we can continue to make incredible strides in improving patient care.
I love that, embracing change and being part of a community that's dedicated to improving care. That's really at the heart of nursing. As we wrap up this deep dive, I wanted to touch on something we briefly discussed earlier, those barriers to research utilization. What can nurses do to overcome those challenges and make sure that research findings are actually making it to the bedside?
That's such an important question. One of the biggest things is to make research more accessible. Instead of just reading those long, dense articles, look for summaries or evidence-based guidelines that, break down the key findings in a more digestible way.
So it's about finding those user-friendly resources that fit into a busy nurse's schedule. Are there any other strategies that can help?
Absolutely. Another key is to, build a culture of EBP in your workplace. This means creating an environment where nurses feel comfortable asking questions, sharing research, and, trying out new ideas.
So it's about making EBP part of the everyday routine, not just something we do occasionally.
Exactly. You can also advocate for resources and support from your leadership team.
Okay.
This might include things like dedicated time for professional development, access to research databases, or even just having a journal club where nurses can discuss research articles together.
That makes me think back to what you said earlier about the importance of community. Having a support system in place can really make a difference.
It really can. And don't underestimate the power of your own voice. When you see a practice that could be improved based on evidence, speak up. Share what you've learned with your colleagues. Present research findings at staff meetings and be a champion for change.
It's about being empowered to use our knowledge to advocate for better care.
Exactly. Every nurse has the potential to be a change agent.
Yeah.
Never underestimate the impact you can have.
That's so inspiring. It feels like we've come full circle in this deep dive from understanding the foundations of nursing knowledge to seeing how that knowledge can be used to transform practice.
We really have. And remember, this is just the beginning of your journey as a lifelong learner. Embrace those aha moments. Keep asking those why questions, and never lose sight of the incredible impact you can have as a nurse.
This has been such an amazing deep dive into the world of nursing knowledge and research. To all our future nurses out there, remember, knowledge is power, and you have the ability to make a real difference in the lives of your patients. Keep learning, keep exploring, and keep pushing the boundaries of what's possible in nursing. Until next time, happy nursing.